Meet Julie. While usually very active, unexplained joint pain and fatigue have slowed her down significantly for the past several months. Her doctor prescribes rest and ibuprofen, but unfortunately her symptoms only worsen. When she visits her doctor a second time, he is concerned Julie may have the early stages of rheumatoid arthritis, or RA. After confirming the diagnosis with lab tests and imaging, he prescribes a high-cost specialty drug. Julie is disappointed to find out that this particular treatment will require her to travel to a special clinic once every 8 weeks to receive infusions of the drug, and there's potential for some pretty nasty side effects. But what else can she do? Her RA symptoms are worse. Unfortunately, Julie's story is all too common for RA sufferers. Many patients receive treatments that are too aggressive for their disease, cause unnecessary side effects, and require travel to special centers for treatment. On top of all this, the prescribed drug is expensive. And since Julie is on a high-deductible health plan, she'll have to cover a large portion of the cost on her own. Fortunately for Julie, her health insurance company has partnered with eviCore Healthcare to review its members' use of specialty drugs and to direct them to more appropriate and cost-effective treatments when it's in the patient's best interest. Before Julie begins her treatment, her doctor submits a request for the prescription to eviCore Healthcare, where a board-certified doctor from eviCore's specialty drug program reviews Julie's case. Referencing well-established clinical guidelines and scientific research, he determines that a different specialty drug is the more appropriate course of treatment for Julie, will result in fewer side effects, and allow Julie to take a pill at home instead of having to travel to a clinic during the workday. And the new drug will actually cost a lot less. Good news for Julie and her health insurance company. Julie's doctor agrees with eviCore, and with the authorization in hand, he is able to prescribe the lower-cost treatment and get Julie back to living a healthy, active life. eviCore Healthcare partners with providers and health plans to enable better patient outcomes and enhance safety. For patients like Julie, this means that they will receive the most clinically appropriate treatments and tests while avoiding unnecessary side effects, cost, and lost time. For providers, it means having access to valuable resources backed by up-to-date clinical evidence, which will ensure that their patients are receiving the best tests and treatments to meet their needs. For healthcare payers, it means that their healthcare dollars are being spent on the most effective treatments and procedures for their members. eviCore's specialty drug solution is the right choice for your patients. Find out more today.